The medical term bruxism is a parafunctional activity and refers to grinding, grating and clenching of teeth. The two main types of bruxism occur during sleep, or what is known as nocturnal bruxism, and during the day, awake bruxism. Dental damage may be similar in both habits. The force of bruxing is much greater than normal chewing. This force can cause flattened or worn down teeth, teeth chipped off at gum line, fractured teeth, and loose teeth. Bruxing can also cause the inner layer of the tooth to be exposed and cause tooth sensitivity to hot or cold food. Common signs and symptoms of bruxism include a sore or tired jaw, sensitive or fragile teeth, earaches or jaw joint pain.